day, everyone. My name is Dr Fundi Nyati, a qualified family physician and also a chief executive of Proactive Health Solutions, which is an employee health and wellness company that's been in existence for the last 23 years. I'm also the founder of Dr Fundi Digital Channel, a channel that's been in existence now for the last 3 years. It's focused a lot on profiling of various people throughout South Africa who are doing great things in the healthcare space. Today, I'm very excited because we're adding another offering within the Dr Fundi Digital Channel. And that offering is a weekly podcast that is going to be, or that has been named Health Matters by Dr Fundi. This will be a podcast that will allow me to share my views, my opinions, stimulate conversations about various issues that are taking place in our healthcare system in South Africa. Private healthcare, public healthcare, policy issues, issues in parliament, issues in the private healthcare industry. So it's going to focus on anything that is of public interest across the board. So I urge you to please, give some love to this podcast, because it is going to be, something that, when we look at healthcare in South Africa, there's not much conversations around matters of healthcare. When they do come in the various media platforms, it's when there has been some situation, tragedies, bad things happening. But I think there's a lot to talk about, good things and not so good things. And so I would like everybody, to engage with these podcasts. And there will be opportunity as well for people to respond through voice notes or WhatsApp or different things, so that we make it interactive. Remember, in South Africa, we have a constitution. And that constitution, in section 27 of that constitution, it guarantees that everybody, every citizen of this country should have access to healthcare, quality, affordable healthcare, and also emergency healthcare for everybody. No one should be denied emergency healthcare, whether it's a private facility or public facility. So Section 27, so health is a basic right, of everyone in South Africa. And so it is important that we have conversations about, how are we doing as a country to ensure that people have access to quality healthcare? And what are the impediments or challenges that make people not to be able to realize that basic human right that is enshrined within our constitution? And so this Health Matters podcast by Dr Fundi will be an avenue to challenge things, also to provide solutions where necessary, or at least recommendations. But it is important that we make it an interactive kind of podcast. So I look forward to people, following us, subscribing to us, so that we can grow the base and have more voices that talk about matters of health in South Africa. On this inaugural podcast, we are going to be tackling two issues. The first issue is a momentous event whereby our first Health Ombudsman, Professor Malegapuru Makgoba, bowed out after his non-renewable 7-year term as a health ombudsman. He called stakeholders on the 29th of May, 2 days before the end of his term, and he had a lot of things to say, some of those quite scathing about our healthcare system. So we'll talk about that. The other issue that we're going to be talking about is the issue of the Portfolio Committee on Health in Parliament in Cape Town. They approved the National Health Insurance Bill. This was after a period of over a year of public participation, whereby opposition parties, communities, NGOs, other interested parties were given opportunity to share their views and opinions around this envisaged national health insurance. So, after a long process, ultimately, on Friday, that NHI bill was approved, which is just one step in Parliament. There are still other steps whereby it needs to go to the National Assembly to be debated, but also in the National Council of Provinces to be debated before it can go before the President to sign it into law. So I think it's a momentous event. The fact that a certain structure of Parliament has already approved this NHI bill. Not everybody is happy about that event, but we must acknowledge that it's a milestone, nevertheless. And so we will just talk a little bit about what does that mean. So let's go back to then the first, topic that we're talking about today. The first topic, like I've already mentioned, is that today we are going to be focusing on that momentous event when the first health ombudsman, Prof. Makgoba, was bowing out. He had an event in Medlin, Maine on the 29th of May, where he invited a lot of people, a lot of movers and shakers in the healthcare space, previous ministers, and other, decision makers or influencers in the space. What is important is that when one looks at what he shared with the stakeholders there, it appears that Prof. Malegapuru Makgoba, when he looks at his 7-year period as the first health ombudsman, he left the office not a very happy man. He was able to share the number of cases that he dealt with during his 7-year period, just short of 11,000 cases that he was able to complete. These are complaints from the public about various issues that he was not happy about, or issues that the public brought to his office for the office to resolve. The complaints to that office, they come from any member of the public or structure, but also some of those he initiates them himself after seeing them on the news, and they are within his mandate or scope. Now, when one looks at the media or the reporting after that event, different media have said different things about this event and what he shared in that event. If I just look at the News 24 article that appeared on the 1st of June, written by Yoli Swasobua and Adiel Ismail, the headline says, "The sick state of South Africa's public health care." It also says, "The watchdog blasts Gauteng's Mickey Mouse-led health department. Prof. Malegapuru Makgoba was appointed in 2016, and obviously his term was now coming to an end after a 7-year term. The outgoing Health Ombudsman has painted a grim picture of the state of the country's public healthcare system. That's one of the highlights of this article. He also said, which is another highlight, you have your best province run by Mickey Mouse, Professor Malegapuru Makgoba said about Gauteng, which made up the bulk of the complaints his office dealt with. But his criticism didn't end with Gauteng. He also had things to say about the Free State. He said there is disorder in the Free State, and also described my home province, the Eastern Cape, as dysfunctional and an embarrassment. Those are very, very strong words that he used when assessing, the state of our healthcare system. Remember, sitting in that office as the Health Ombudsman, he has a mandate to deal with complaints from each and every corner of South Africa. Many of us only are aware of maybe 3 or 4 of the investigations that he did. One of those being the Life Esidimeni debacle in Gauteng, whereby 144 of our compatriots died when they were released from hospitalization to NGOs that were not capacitated to be able to deal with people with those long-term mental health challenges. That has been followed by another process whereby issues of criminality are being investigated, and that's currently underway. So that's one of the investigations of that office that we know about. But there are others as well, like the young man who died at Tembisa Hospital during COVID after having tried to contact the then National Minister of Health, requesting that he gets, proper healthcare services at that hospital. And this office of the Health Ombudsman was involved in that process, and a report was issued. The other, report that he issued about a month or so ago was a report on a year-long investigation on problems or the harrowing conditions of pregnant mothers at the Rahima Musa, hospital. Even in that, he was quite scathing in the reports. But there's many reports that are not high-profile reports that he actually dealt with. But when he was talking to the stakeholders, he was just giving his views about the state of our healthcare system. And one thing that is clear, he is leaving that office very, very unhappy about the state of the healthcare in our country. He was interviewed on 702 FM on the 1st of June in the morning, and he was asked specific questions there. For example, what do you think about the state of healthcare in South Africa? Is there anything that surprised you about how bad things are when you actually got to the office? His answer was, wow, actually, I knew that things were bad, but I did not think they were as bad as what I actually saw and experienced. He went further to say he actually thinks he was in denial before, but now that he has been in that office for 7 years, he now understands the gravity of the problems that we're faced with as a country. He was asked another question. The question was, what does he think of the planned national health insurance? Does he think South Africa needs it, number one? And what are his views about it? And also, whether he thinks South Africa has the capacity to pull it off. His answer was South Africa does need the universal healthcare coverage, so he was in support of that. However, he was very clear about the fact that he does not believe South Africa, at the point we're at, with the leadership and the government we have at this point, he was very clear that he does not believe they would be able to pull it off. Back to the stakeholder engagement meeting, he said something about South Africa sometimes does not have the right priorities. South Africa prioritizes legislation around cannabis rather than focusing on other important issues, including the independence of the Health Ombudsman Office, which at this moment is operating under the Office of the Health Standards Compliance. He's advocating that this kind of office of the Health Ombudsman should actually be independent in the same way as the Public Protector South Africa. So he feels that the lack of independence of that office makes it, to be prone to certain, challenges around independence. But I think what's important for us is to say, what can we do as a country to make sure that that office, which listens to stories from everybody who is unhappy in South Africa with the state of the healthcare, I think all of us as South African citizens, we need to support that office. Obviously, it was created by government. It needs to be better funded, better resourced. Because when he was asked about the staffing, he started being the only person in the office. And, at least now there's a couple of investigators, that are working there. But it does sound like they've got constraints as far as capacity is concerned. But at least they have been able to complete almost 11,000, complaints, which I think is a good thing. We need more of that because the problems in our public health system are actually quite serious. So my view is that South Africa, we actually need to take the comments by the outgoing Health Ombudsman very seriously. Today, we heard that Professor Taule Mukwena, my former prof at University of Natal, a mentor, has been appointed as the new Health Ombudsman. So it's going to be very important for him to take over from where Prof. Makgoba ended and actually take that office to the next level. So we look forward to seeing what changes will be made to actually strengthen that office, because as time is progressing, things are worsening within our healthcare system, and therefore complaints are going to be coming in numbers, and therefore capacitation of that office and the independence of that office, I think it's a non-negotiable. So I think as a member of public myself, I think my view is that the government must take the criticism positively and do everything in its power to make sure that it functions the way it was expected. I thank you.